Hi, I'm Dr. Jack Clyde, and I'm sure a lot of you have seen this ad on TV. It starts out with, this is Bob. He's a regular guy, but he has an irregular heart rhythm. Now, Bob has atrial fibrillation, which can cause a stroke. So what I'm going to talk about today is atrial fibrillation, basically. I would estimate now in this country there are about 5 million people with atrial fibrillation, and the incidence is increasing yearly, not only in the United States, but globally. Now, I'm just going to talk about a patient of mine so you'll understand what atrial fibrillation is. I got a call the other day from a patient who told me he had palpitations and he was feeling fatigue and short of breath, and his heart was racing, and I advised him to come into the office immediately. He comes into the office, and I examine him, and I do an EKG, and I find out he's in rapid atrial fibrillation. Now, atrial fibrillation is an irregular rhythm of the atria, which are the chambers above the ventricles. They just don't beat properly, they fibrillate. So what happens is the atria really are not pumping adequately, and the blood inside the atria is moving more slowly, and because it moves more slowly, clots can form. And those clots can go to the brain and cause a disastrous stroke. Now, the incidence of stroke in patients with atrial fibrillation compared to the normal population is 5-fold. As a matter of fact, the incidence of morbidity and mortality is 2-fold in patients with atrial fibrillation compared to the normal population. Symptoms vary. Some patients can have palpitations, which are rapid heartbeats. Some patients can be have shortness of breath. Some patients can be fatigued. Some patients will have lack of energy. Other patients will be dizzy. Some patients are asymptomatic with no symptoms whatsoever. Now, if you do feel you have this cardiac arrhythmia, you should see your physician or your cardiologist. Now, I want to impress upon you one pearl of wisdom with the treatment of atrial fibrillation. No one size fits all. Not everybody gets the same treatment. It depends upon your risk. And there is a risk score. It's called CHADS, C-H-A-D-S 2, CHADS 2 score. You calculate that score. Just simply what it means is C stands for congestive heart failure. If you have that, you get 1 point. H stands for hypertension. If you have that, you get 1 point. A stands for age. If you're over 75, you get 1 point. And by the way, this atrial fibrillation can happen to much younger patients. D is for diabetes mellitus. If you have that, you get 1 point. S is for stroke. If you had a previous stroke, there are 2 points. So if you have a high CHAD score, you're a candidate for blood thinners, for anticoagulant therapy. And there are several choices depending upon your individual risk, your age, your underlying diseases, your comorbidities, etc. One size does not fit all in terms of the treatment for atrial fibrillation, because there are different options for different people depending upon their risk. And I hope you take that to heart.